People with ADHD are twice as likely to smoke or vape nicotine compared to somebody without the disorder. But why? Today, I, a drug scientist, am going to lead you through the myths and the truths about why people with ADHD smoke. So, what we see is that there is a very strong relationship between smoking or vaping nicotine and ADHD symptoms. Now, it's not just the diagnosis. So, if you have asymptomatic, if you have the diagnosis but you're not currently displaying symptoms, then you are actually not more likely to smoke. But if you have the ADHD diagnosis and have symptoms, specifically things like hyperactivity and impulsivity, that makes you more likely to smoke. So we see a actually pretty strong positive correlation here. So basically, the more symptoms you have of ADHD, the more likely you are to use nicotine, and the more likely you are to use it even earlier in your life too. So why? Let me start with the ideas that we previously had that turned out to not be supported by science. So the first one is this idea that people with ADHD use stimulants, and stimulants might make you more sensitive to other stimulants. So you take ADHD meds like Ritalin and Addy, and those types of meds increase dopamine, and so maybe you're just more sensitive to other drugs that increase dopamine. And we do see that nicotine downstream affects dopamine. So it is primarily working on the acetylcholine system, but it does seem to increase levels of dopamine in the brain. And so this initial idea was basically like, well, we see that ADHD meds increase dopamine and this other drug increases dopamine too. So maybe those meds just make people more sensitive to nicotine's effects in the dopamine system. And what we see is that this is actually the opposite of what typically happens. So weirdly, ADHD meds don't seem to actually increase the risk of using nicotine later on. It seems like it might actually decrease the risk. There is also this idea being thrown around that people with ADHD are just more sensitive to peer pressure, so they're more likely to use nicotine because people are telling them they should use nicotine and their friends use nicotine, and so they're just more likely to give in. This is not really supported by the data, and I feel like this, even if it might be true, is definitely not like the main reason why people with ADHD smoke so much more. Like, that would be some pretty persuasive peer pressure to have that happen, and I don't think that's likely as like the primary reason. Now, side note, persuasive peer pressure would be another great band name. I'm thinking yacht rock for that one. Now, what are some reasons that are actually supported by the science? Well, the first is this idea of self-medication. So when we talk about why people with psychiatric disorders use any drugs, self-medication is a big one. So people will either think that they are self-medicating for their symptoms with drugs, so using a drug that they think is going to help them not feel as depressed, but in actuality, most drugs are going to actually make that worse. Or the drug could actually help with some symptoms of the disorder. So for example, we see that a lot of people with schizophrenia smoke, and one of the primary reasons why they say they smoke is because the nicotine is actually helping with some of the like memory problems that people with schizophrenia have. And this is true for ADHD too. So what we see is that patients with ADHD typically have problems with things like focus and inattention, and nicotine is a cognitive enhancement drug. It helps with things like memory and focus and attention. Like, we've even done the science where we put nicotine patches on people with ADHD, and those nicotine patches do seem to decrease some of the symptoms of ADHD. So the self-medication is kind of working there. And as mentioned, nicotine works on the dopamine system, and so do most of the ADHD medications. So what happens is that maybe you're actually kind of helping the ADHD symptoms because it's just another version of an ADHD med, just in a recreationally used substance. There's also this idea that like the genetic components of ADHD are similar to the genetic components of nicotine addiction. So maybe there's like a vulnerability to both depending on the genes involved. Now, here's the thing. Pretty much every psychiatric disorder does not just involve a single gene. So like they are all multi-gene disorders. And addiction, unsurprisingly, is not a single gene issue either. So you're looking at all of these different interactions of things like maybe it's a gene that deals with reward. Maybe it's a gene that deals specifically with the dopamine system. Maybe it's related to the acetylcholine system. We don't know. But that could be a possibility. We just haven't done a ton of research on that yet. Now, the last one that I want to talk about is one that you probably have not even potentially considered, and that is MAOIs. So tobacco doesn't just contain nicotine. It also contains a variety of other compounds. And some of those compounds have MAOI properties. So those are monoamine oxidase inhibitors. So they are things that are basically inhibiting the thing that breaks down monoamines. You might have heard of this term because MAOIs are commonly used as like an antidepressant. And we see that these compounds, or the compounds that have MAOI effects, are actually very interesting in terms of how they interact with nicotine. So we see that MAOIs actually make nicotine more reinforcing, so it makes that smoke break actually more rewarding if you take it. Like MAOIs are also commonly used for ADHD treatment. So there might be something here that has nothing to do with the nicotine, but the other components that are in tobacco and in some e-cigarette juices. But this area is actually very rarely studied in the nicotine and tobacco field, even though it's kind of fascinating. I say as a person who is actually in the middle of running an experiment on this kind of exact topic. So why do people with ADHD smoke? What's the easy reason? Well, it is not actually the ADHD meds they're taking. That one seems to be debunked. And like not just peer pressure, but it can be a variety of different things. So you can have maybe like sensitivity to impulsivity, and we know that impulsivity is linked to things like drug addiction of all sorts. It could be self-medication. It could be the use of other compounds in tobacco and nicotine juices. It's probably not just one of them. It's probably a combination of a whole bunch. And none of that, by the way, takes into account any of the environmental influences that could deal with it too. Welcome to the fun world of addiction research.